New at 5, state lawmakers are trying to fund the 988 Mental Health Crisis Hotline at the state level since federal grants that currently fund the program end in June. Fox 23's Devin Lyon talked to a lawmaker leading that effort, as well as Grand Mental Health, about how critical the hotline is for Oklahomans in crisis.
So it really has been a game changer for Oklahoma. And so with this funding, we will be able to keep 988
on a daily basis. Throughout the day and night, we are consistently and constantly collaborating with folks at 988 to serve our clients.
The clock is ticking to fund a critical mental health resource in Oklahoma. Federal grants that pay for the 988 Mental Health Crisis Hotline are set to expire in June. Now, some state lawmakers with bipartisan support are hoping to keep the services alive with state dollars.
The ability to use 988 has kept people out of the emergency room. It has unclogged 911. Because the calls are going to 988 rather than 911. And that keeps people out of the emergency room, like I said, and being admitted to hospitals.
State Senator Brenda Stanley filed legislation to continue 988 funding at the state level.
We're asking for $5.7 million to be appropriated annually. We're hoping that $1.1 million can be offset by the federal government.
Since coming to Oklahoma in 2022, 988 has been championed by lawmakers on both sides of the aisle. In that first year, the service reported about 40,000 calls from Oklahomans. New data shows about 7,000 to 9,000 calls are made to the hotline every month in the state.
Devin, to be honest, I think the phone rings essentially off the hook. We are consistently and constantly fielding calls.
Providers like Grand Mental Health in Tulsa say it's critical for the work that they do.
If we didn't have 988 and we didn't have access to care 24/7, unfortunately, we would probably see an increase in suicide completions. We might even see an increase in individuals not being able to access the care that they need.
At the state capitol, the biggest hurdle could be fitting the budget into a flat state budget, similar to last year. But Stanley is confident the measure will pass. Providers like Grand say they support any efforts to invest in 988 and hope to build on its progress as the mental health crisis continues to grow in the state.
Honestly, Devin, things that I don't even want to imagine or think about, but it would not be good for the community in the state of Oklahoma if we didn't have 988.
Covering news that matters, Devin Lyon, Fox 23 News.
Another way the funding could continue at the state level is if the State Department of Mental Health adds it to their budget request later this spring. If the governor requires a flat budget again this year, that $5 million, though, would have to come from another place in their budget.